Thanks, Tony. Breaking news on the state's coronavirus cases. 13 more people have now died of the virus.
The total number of cases rose to over 4,000, with more than 30,000 tests being conducted so far. Here's a look at where things stand right now.
Those 13 additional deaths bring the state's death toll to 118.
As of this afternoon, 252 COVID-19 patients are hospitalized. This includes 62 in the ICU and 43 on ventilators.
And 10 of the 13 new deaths were residents of nursing homes. The Department of Health has announced a new string of protocols to try and safeguard residents and staff there.
Governor Gina Raimondo also announced Beacon Mutual Insurance Company will start presumptively approving workers' compensation claims by filed by caregivers who test positive for the virus.
Eyewitness News reporter Ted Nisi is at the State House with what Governor Raimondo had to say about field hospitals and when restrictions could be lifted. Ted?
Good evening, Shannon and Mike. Well, there is some skepticism out there about the sobering forecast about coronavirus that the governor put out yesterday, but she says her motto is plan for the worst and work for the best.
And our cases are still continuing to go up, deaths still going up, hospitalizations still going up.
One day after telling the public Rhode Island may soon need more than 2,000 hospital beds for COVID-19 patients, Governor Gina Raimondo pledges the state will be ready.
I want to thank our hospital leadership who have put forth their own plans, which we've approved, to increase their collective capacity by almost 250%.
Rapid construction now underway to convert multiple facilities into temporary field hospitals.
Due to a lot of hard work, we, in a couple of weeks, will have the capacity in 2 field hospitals, one at the Convention Center and one at the former Citizens Bank complex in Cranston, for over 1,200 new beds.
Progress also being made on locating skilled workers to staff those temporary hospitals.
More than 3,300 healthcare professionals, physicians, nurses, CNAs, and the like, have already gone on to riresponse.org to join our state's response. It's incredible.
By next week, the state hopes to have in place a 30-day stockpile of key medical supplies, from personal protective equipment or PPE to ventilators. More than 10 million surgical masks said to be on order.
So if you're out there and you're a healthcare worker and you're frustrated that you're having a hard time getting access to PPE, help is on the way.
All this allowing the governor to hint she may be able to start lifting some restrictions once her current stay-at-home order expires May 8th.
The reason I'm focusing now on hospital beds and PPE is because those were all the necessary conditions that I had to have in place before we can think about safely reopening our economy.
And the governor says she'll have more to say next week about reopening the economy. Coming up at 5:30, a change of pace. We'll take a look at the images that defined this past week in southern New England. Live at the State House, Ted Nisi, Eyewitness News. Well, with Rhode Island and Massachusetts both under stay-at-home orders for another week, many of us have found our worlds have shrunk dramatically. But while we may not be physically together, there are still many signs of community spirit across our region. Our chief photographers, Corey Welch and John Filella, put together this snapshot of local life in these unusual times.
Hope is a theological virtue, but it is also the motto of the state of Rhode Island. It's true, we don't know all the details of the future, but we know that our lives will not end in emptiness and frustration. Because we have hope, we live differently.
And they were just like, thank you so so much. Like, we appreciate it. It was just, it felt so, like, humbling and, like, so good. Because the only thing we need right now is, like, positivity.
And all I could think to do was start sewing masks for everybody I knew, my friends, my family, my neighbors, people I knew who worked in healthcare.
Ultimately, they're dealing with it day in and day out inside that hospital, and nothing but it. I just believe that the support that we're showing is just hopefully to make someone smile tonight and make them realize that we're stronger together, and we'll get through this.
Those scenes and images because you shared them with us. So if you see something out there that makes you smile despite our current predicament, let us know. Live at the State House, Ted Nesi, Eyewitness News.